Good afternoon and welcome. My name is Tom Hecker, and I have the privilege of serving as the president of the Abington Township Board of Commissioners. I am delighted that you have joined us this afternoon for the Township's 37th annual Memorial Remembrance honoring Dr. Martin Luther King Jr. I am proud of the Township's longstanding commitment to remembering and honoring this legacy of service. I am also proud that we have the opportunity today to honor one of our own residents, Dr. Alice Stanford. We are a better community for having Dr. Stanford as part of it. Her life and her career have focused upon serving those among us most in need. Dr. Stanford's convictions, her empathy and devotion are deeply rooted in family and community. Her work in founding the Black Doctors COVID-19 Consortium was groundbreaking, and her team was able to reach communities that were being disproportionately affected, yet underserved. It is a privilege to have her join us today, and I hope that you truly enjoy our program. Thank you again for participating.
Hello, my name is Jeffrey Fetcher. I'm Superintendent of Schools for the Abington School District. I'm honored to be here today for the 37th Annual Memorial Service to honor Reverend Dr. Martin Luther King Jr. I'd like to thank members of the Township leadership who have put on this event continually over the years. We truly appreciate it at Abington School District. Dr. King stood for many things, but what stands out in my mind, especially during a time of COVID-19 pandemic throughout our communities, is his commitment to service. Dr. King's commitment to service is an inspiration to all of us. And I have to say that when I look at our community over the past year and a half to 2 years, I saw that commitment to service come from many angles. I am proud of our families in this district who reached out to us to help our students and staff members during a time of need. Our student groups got together, collected PPE items. They also worked and did things like a lemonade stand to support buying lunch for healthcare workers at Abington Jefferson Hospital. Our students reached out to places like nursing homes to give performances because our nursing homes could not have visitors. So our students did this virtually, and many countless activities and events to help our community. So I am extremely proud of all these efforts. One of our key leaders in this commitment to service, Dr. Stanford worked with Abington School District on many levels to help us through this pandemic. One that stands out in my mind is her hosting a question and answer session for school-aged vaccines. This truly helped some of our parents navigate the question of having a vaccine or not. Further, I'd like to congratulate Dr. Stanford on being this year's award recipient. It is well deserved, and we are proud of you in Abington School District. Finally, I'd like to make sure that we thank our student performers and the hard work that they put into this service. I'd like to thank the music department, as well as Dr. Christopher Brown, our equity officer, for making this possible. Once again, I appreciate being included in this event as Abington School District and supporting the honor of Dr. King. Thank you.
Hi, my name is Jeffrey Brown, and I'm a member of the Abington Township Human Relations Commission. It's my privilege to be a part of this Dr. Martin Luther King Jr. annual celebration here in Abington as we have a conversation with Dr. Ayla Stanford. Dr. Ayla Stanford, a practicing physician for over 24 years, is board certified by the American Board of Surgery in both pediatric and adult general surgery, and she is a healthcare advocate. Dr. Stanford is the founder of the Black Doctors COVID-19 Consortium, or BDCC. The consortium was formed in response to the disproportionate number of African Americans being diagnosed and dying from coronavirus in Philadelphia and the lack of swift intervention to mitigate the spread of the disease. The mission of the consortium is to educate, to provide advocacy and barrier-free coronavirus testing and vaccination to decrease the morbidity and mortality associated with the disease. To date, BDCC has tested over 25,000 patients and has vaccinated over 53,000 patients, over 1,000 of which have been vaccinated in their homes. On November 3rd, 2021, Dr. Stanford opened the Dr. Ayla Stanford Center for Health Equity to continue offering quality healthcare and education to the city of Philadelphia. It's my pleasure to have a conversation with Dr. Ayla Stanford. So, first question. All right. So, in the vein, and we're here to celebrate the life and legacy and vision of Dr. King. So, with all of the work that you've done, how do you see a connection between the work of Dr. King and your work with the Black Doctors Consortium and even your greater work as a physician and a surgeon?
Well, first, to even hear my name in the same sentence as the Reverend Dr. Martin Luther King is very humbling. Last year was the first time, maybe, and I just felt I'm not worthy. I'm not, this is not the same. But several times along these 2 years, I felt like he felt. It must have felt. I mean, I felt alone. I felt like sort of everyone was against me, that I'm trying so hard. Like, why can't everyone see that what I'm doing is the right thing to do? That it's so that everyone has a fair shake at health and at longevity and at joy in their lives. And that's all that I was striving for. And why did it seem like I was fighting so much for something that was so basic that everyone was entitled to? And so when I looked at it like that, I felt, yes, that is what he was striving towards. And just that selfless, whatever you might need, putting that on the back burner in the sacrifice for the greater good of others. And so it is humbling. And I'm refueled by the recognition that someone would think or want to bestow on me something that is in the same caliber of the Reverend Dr. Martin Luther King Jr.
Okay. All right. Great. So as we know, Dr. King built a coalition of different groups, and in large part, in the civil rights movement of the 60s and even before then, and maybe even after that, we've seen like the Black church and other faith-based organizations be the launching pad for some of those campaigns, right? How important was the Black church in general, right? Other faith-based organizations to the success of the consortium?
Invaluable. The Black church, the backbone. And just from a business perspective, it's the something that as African Americans, we own in this country, that you don't have to ask for permission. So yes, your heart is in the right place. And we know that we're all just vessels doing the work of the Lord. However, business, capital, ownership, real estate, the only real estate is property. That's also what the Black church gave us. So one, the church has always been one of service, of mission, of giving to those who without, of doing what would Jesus do, right? And so in that vein, we were all the way there. And then it was, well, I need your parking lot. Okay. Can I use your electricity? Yes, my sister. Can we use your restrooms? Absolutely. Do you need our security folks to help you with the flow of traffic and people coming in and out? Yes. Then it was the mothers of the church. You need to eat, baby. You're not eating. They cooked for us. They fed us. They prayed for us. They were joy for us to see every day as we were coming to work. And then we took care of them so much so that they felt like we were working for them. So they would just show up through the back doors and this door of the church to come and get their test and get their vaccine. Well, I'm a member of the church. And we were like, yes, so-and-so. Yes, brother, come on in. And so, but with all seriousness, there is no way that we would have been able to move so quickly with such alacrity. And I have to give a shout out to my pastor, Marshall Paul Hughes Mitchell of Salem Baptist Church of Abington. We were formerly Jenkintown, but always in Abington Township. Because when I called him and he said, well, what do you want to do? And I said, I got to test Philadelphia. And immediately we need to go to the church. All right, where are we going? Let's find the zip codes where the positivity rate is the highest for COVID. And he identified a church in every one of those communities. I gave him the zips. He's like, okay, for here, we're going to Enon. Pastor Waller has been a huge support of us. We're going to Glen Spalding, 19132, right? We're going to Victory Christian Center and Southwest. We're going to Mount Airy Church of God in Christ. We're going to Christian Stronghold. I've been to more churches. We're going to New Covenant. We're going to Bethlehem Baptist with Pastor Quan. We've been everywhere. And not once did a church not welcome us wholeheartedly. When we had no money, I couldn't pay them a facility fee. I couldn't pay them for the use of their Wi-Fi. They were feeding us, making us cheesecakes over at Christian Stronghold. Those cheesecakes were good, and frying us fish at Deliverance and on, and never once asked us for a cent. So once we started to get grants from the city and from other agencies, that's when we were able to give back and say thank you, but they never asked us, right? And so how integral, I can't even put a value on it. Even the Dr. Ayla Stanford Center for Health Equity, which is an annex of Deliverance Evangelistic Church in North Philly, is because I had a vision that Pastor Spalding saw with me and helped me bring to fruition, that now we've served over 2,000 people since November 3rd of 2021 and continually doing that. And so integral, just like for Dr. King, like for Dr. King. So invaluable.
That's awesome. That's awesome. So let's continue down that theme of vision. Because we do have a couple of questions about vision and inspiration. So first of all, what inspired you to take this action, right? To respond to these racial disparities? And then how can we inspire and encourage those, especially young people, who feel that maybe I'm just one person and I don't have the ability, power, influence, to do anything?
What inspired me was, so many things, but it all goes back to when I was an 8-year-old, when I was a 15-year-old, and when I was a 20-something-year-old in medical school. So when I was an 8-year-old, my mother used to take us to Health Center number 3, right? To a health clinic in Philadelphia. And it wasn't super clean. It didn't feel like it or anything, but there was a doctor there, a Black woman, who I wondered, well, how did she get to be here? And she looked so happy and she looked relaxed, not like most of the Black women I was around that always seemed to be working and struggling to survive and things like that. And that vision stayed with me. Then by the time I was in high school, I knew I wanted to be a physician. So every opportunity I had to shadow a doctor, to learn about science, at the time to read Gifted Hands, which Ben Carson had written, which was the first time for me that I could see someone who had come from poverty, a single mother, that in his brilliance, his mind was his way out of a situation that was not pleasant. And I thought, man, that could be me. And I remember that. And then in medical school in my 20s, and I'm like, I'm finally here. I made it. I'm going to be changing people's lives. And then it was something that saddened me as I heard about the health disparities and that African Americans have a shorter life expectancy, that they have, more advanced diseases and breast cancer and colon cancer, and that they have died more frequently from cardiac disease. And and in that moment in my 20s, I felt helpless. I felt like, Dag, I got this far and I'm learning all these statistics. Like, how am I going to do anything in my 20s? And I just kept my head down, working hard to get to a point where I could help people. Then fast forward to the pandemic, I'm watching the news and I'm hearing the same thing. And it was like a flashback to my 20s. Well, African Americans are, they have more chronic health conditions. And because of that, they're getting coronavirus disease at a higher rate and they're dying more than other groups. And I said, wait a minute. Now that doesn't sound accurate, right? Because my friends were calling me and saying, Ayla, I think I have COVID, but I can't find a test anywhere. And they were educated and they were Black and they were going different places and they took care of themselves. They had and I'm like, well, what's happening? And then I realized that the real reason was access. And it didn't matter if you were Black and poor or Black and rich. It was access that was precluding people from getting the testing and contact tracing at the height of the pandemic. And so that's what inspired me, because I wasn't that 20-year-old something that couldn't do anything anymore. Now it was 2 decades later and I had my own practice. I had some business acumen. I had been training for a doctor for years. And I said, okay, people are getting sick from a disease. They don't know they have it and they're spreading it to other people. Well, I can help them determine if they have it, let them know so they can let other people know so it doesn't spread. So if they get some early intervention or treatment, even though there's no cure, that may prolong their life and reduce the death. For me, it seems simple. And that's how I sprung into action. And I know that's sort of a long story, but it sort of encompassed the answer to both questions, is because I think the younger you are when you decide what you want to do with your life, the more ingrained it becomes. And you never see yourself doing anything else except that. So when I was in 8th grade, I was looking for something. When I was in 8th grade, this is so funny. This is a plaque that I received. This is 8th grade, and it says oratorical contest, right? See that? 1984, I think it said 1984, okay? And it was for the Reverend Dr. Martin Luther King oratorical contest. And we would recite, I Have a Dream, right? And I still remember that. And what that helped me with was public speaking, and infusing emotion, getting a message and connecting with people. And I was only 12, 13 years old, right? And so when you're young and and I didn't know at that time but when it's something you want to do, then when people tell you you can't, you're like, no, I'm going to do this. There's nothing else I want to do. And so it's finding someone. Now, I used to have this acronym. Let me see if I can remember it. It's VERB, and VERB is an action word. So V, you visualize yourself doing it. You picture yourself, whatever it might be. It could be president, be a governor, a doctor, a lawyer. It could be owning your own maintenance company and keeping the school clean and neat. It could be owning your own fleet of buses for the bus service. It could be anything. It could be being the best postman and then being the highest level. It could be owning your own beauty salon or haircut place, right? You visualize yourself doing it. What part of the world would it be in? How many people would you hire? Then you emulate. You find someone that's doing what you want to do and you try to attach yourself to them. Nowadays, you could read about them on social media, right? R is you read. You read everything you can get your hands on about that subject, right? Or about something you want to change and make better in the world. And then B, you be honest with who you are, honest with your skill set. Like if you want to be an astronaut and you can't see, I don't know. Maybe that's not the field, but who knows? Maybe there'll be some technology that'll make your vision 2020. But be honest with your skill set. Be kind to people, right? You don't have to push anybody else down to elevate yourself, right? You be you. Be genuine. Yeah. Ambitious.
Okay, that's good. I'm writing this down. I'm taking notes.
Yeah, but I forgot. I came up with that a couple of years ago, doing a commencement address, because people ask me that so often, like what can children do, and for that matter, adults do, and I feel like that acronym is really it. Yeah.
Right. Okay. That is awesome, and I hope everybody caught that in the recording. If you didn't catch it the first time, you need to rewind it and go back so that you can catch it the second time. So that is great, and hopefully our young people really take a hold of that, and really embrace that acronym, right? Verb, visualize, emulate, read, and then be honest with who you are, your skill set. Be kind, be you, be genuine. So thank you so much, Dr. Stanford. All right, got a couple more questions for you. So we're going to dig into the subject of like systemic injustice, specifically in healthcare, right? And for those people in the rear seats who may not completely understand what systemic injustice looks like in healthcare, can you break it down for them a little bit and just provide a brief overview of how racism plays out systemically in healthcare?
Wow. So we don't have enough time on this call, but let's go with
keep it at the 50,000 foot level.
Yeah, let's do it in 2 ways. Let's do it in the care you receive, and let's do it medical as an education, as people coming through in their training. Okay. So I'll do the training part first. In the United States, African Americans represent about 4.9% of practicing physicians. We already know from the Institutes of Medicine and many other peer review areas that people's health outcomes are better when they are cared for by someone who is culturally competent, meaning they are aware of a person's background, their upbringing, even their diet, their cultural norms, and the language. In the United States, African Americans represent, depending on where you look, 13 to 15% of the population, but only 4.9% of the doctors, which means you have a lot of folks who are caring for African Americans. And not to say it can't be someone who is Asian or white or Latinx or so forth that can take care of, but you have to have a cultural understanding. And we are not taught that in medical school the way we should. So what ends up happening are stereotypes and propagation of things that are not accurate. So for example, just in the past year, a group of medical students, when given a survey, said that African Americans have tougher skin and therefore they don't need as much in the way of pain medicine with procedures. Now, these are our new doctors coming through to take care of the next generation. And they honestly believe that. How you see that manifested is when someone of color has surgery and postoperatively they're given Tylenol and Motrin, as opposed to given something that may be stronger, like a narcotic of Percocet or oxycodone, because the perception is that Black Americans are drug seekers. So instead, we're in pain when that is not the true, and it's a stereotype. It's not accurate. Each individual is different. You can't label a whole race of people one way. But unfortunately, that is something that is seen. Another example is when there's this clinic and it's, quote, indigent care. Indigent care meaning it's a person who doesn't have health insurance, or the health insurance that they have is subpar, so it doesn't really pay for the care that's required. So what tends to happen to those patients is they get put in a clinic that's managed by residents. What are residents?
Mhm.
Residents are trainees.
Mhm.
And how the hospital tries to justify it is by saying, well, if they weren't getting this care, they wouldn't be getting anything. So it's okay. But it's not okay. In my eyes, it's not okay.
Mhm.
If you're not licensed and credentialed and board certified to care for a patient anywhere else, why is it okay when the person has no health insurance or suboptimal insurance to then put the trainee to the patient? So that's another thing. Goodness. One of the biggest things I saw during the pandemic were when, as I mentioned, African Americans were going to the hospital and they had insurance and they were turned away over and over. But when I called and I said, this is Dr. Stanford, you just turned away Mr. Johnson. He has symptoms. I believe he has coronavirus. He needs to be tested immediately. No problem, Dr. Stanford. I'll get on it right away. Right?
Wow.
But that individual going in was not getting the care. And so those are just a few with
Just some
care.
examples. Yeah.
Yeah, just some examples. I'm trying to think of other things. I think just the attention, and we have to do better as healthcare professionals when we care for folks. I think in pediatrics, for me, one of the things I loved in training is we never knew what insurance a kid had. And it's a kid, you're not going to treat a kid any differently, right?
Mhm.
And that was beautiful until I came out. There was also a study that came out from the American Academy of Pediatrics, July 2021, that said that a Black child and a white child, both having had an appendectomy, which is a very basic, you take your appendix out, healthy kid for kid across the United States, that a Black child was more likely to be readmitted to the hospital, more likely to have postoperative complications, and more likely to die from that procedure versus a white child with the same medical background of having no health conditions. That was a very poignant moment for us as surgeons, as child care advocates and providers, to say, here's the data. And we're very evidence-based. Like, we look at the science and see that and say, wow, what are we doing? Or what are we not doing? Because surely there's a small fragment, but most people don't wake up and say, I think I want to treat you differently because you're
Right.
Black and you don't
Right.
look like me. I don't believe that most people are inherently racist or biased and believe that. But there are some things that are part of our makeup, how we were raised, call it nature or nurture,
Mhm.
that changes how we interact and how we perceive people. And you've got to recognize those things, especially with healthcare, so that you don't push your own personal beliefs, true or not. If it's not fair, it's not fair, onto another person. And so those are some things that are challenging. I mean, like I said, it's a whole, people study this their whole lives. But I think for me, having been a Black woman who has needed a doctor in my life and being treated unfairly when people didn't know I was a doctor, and then being the person delivering the care, and working hard to get it right all the time, I was poised to see things through a lens that many of our colleagues in government may not have been able to see. So when it came out that it was chronic health conditions as the reason why our outcomes were worse with COVID, I said, no, that is not. Number 1, 2, and 3 reason is access, access, access. Then maybe you put hypertension or diabetes or obesity. Give us a chance to get there. Give us a chance to get there. And so, yeah.
Wow, that's awesome. Thank you. Thank you. So hopefully people were able to catch that. And once again, if you did not catch that the first time, rewind and go back and listen to Dr. Stanford's answer, please, 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 please. So one of the most famous speeches of Dr. King is the I Have a Dream speech. And in that speech, he lays out very poetically, what some aspects of his, dream are. And we have yet to achieve some of those aspects in King's dream. So when you dreamed of the healthcare center, the Dr. Ayla Stanford Center for Healthcare Disparity, and I don't know if I put the correct term on the center. What are some of those things that you dreamed about? Like, what were those things that you envisioned coming out of that center? What were some of those outcomes? Like when you envisioned that, what were some of those things those things that those images that came up in your mind?
The vision, honestly, was for folks to be able to come in and be treated and not have to hear someone say, well, what's your insurance? And then I don't have any, or show your insurance card and it's not active and be turned away. I wanted everyone to receive the same level of care, regardless of your ability to pay. Because so often what happens is you go to certain campuses where, it's private payer mix and everybody's got great insurance and it's bright and it's palatial and everything looks brand new and it feels so clean. And then when you don't have health insurance, you go to a location and it feels, dirty and it's gray and it's not bright and people look overworked and tired. And I did not want that. So my vision was that regardless of your ability to pay, you were going to get quality care, you were going to get empathetic care, it was going to be culturally competent, that someone who, if they didn't know you, was learning to get to know you so that they could give you the best care. And one day I saw that come to fruition because there were folks coming from the church, there were kids walking from Dobbins, there was Patti LaBelle, there was the DA of Philadelphia, there were folks coming from the projects, and they were all there to get their vaccination and their booster. And that was the vision in that moment, because people could have chosen to go anywhere, but because of the trust, because they wanted to take a picture. I mean, let's be honest, right? They were all there, and you're not going to trust your healthcare to just anyone or any location. And that's what we're striving for. The other part is the proximity of being in your neighborhood, of not having to take multiple buses or, a subway or a train to get to good quality care. But for a handful of folks, you could just walk out your door. That folks could come from Bible study, again, because we're an annex, they could come from Bible study on Wednesday or a church meeting and walk over and get a shot, or walk over and get your blood pressure checked. Or, I was having some chest pain and I had a heart attack some time ago, but I wanted to get a repeat EKG. Can I do that? Yes, you can. Or my doc gave me a script to get these labs drawn, but whenever I try to get there, the place is closed. Do you guys do that? Yes, we do. For the students that need the PIAA physicals, our student athletes, that they could come to us, and the fee is nominal, that they could come and get their physicals done so they could participate in sports. And
Right.
so that's the vision, just being able to provide quality, competent, culturally sensitive care in your community. Boy, look at that alliteration. That was my first. And I promise you, I haven't said that before, but since I did just say it, I can do that. In your community, culturally sensitive, competent care. Okay.
There you go. Listen, that'll preach.
Well, I had to get this tape so I can make sure to market on a flyer. 4 C's.
So I'd like to bring it back to Abington a little bit. As an Abington resident, and this is an Abington program. What are some of the things that you see? And Abington is a great community. To your point earlier, it's diverse. And I think we are intentional in Abington about trying to make as many people as we can feel welcomed in our community. But no community is perfect, right? What are some things that you may see in Abington pertaining to healthcare or other ways that you think that we can improve on? First part of the question. And for those Abington residents who may want to help get involved in the work that you're doing, what's the best way to do that? So that's a 2-part question.
So yes, I can call myself an Abington child resident. My first job out of fellowship in 2006 was at Abington Hospital. And I was at Temple Children's, but I was also on staff at Abington. And as I've watched it evolve over the past, 15, 16 years, it has come, in my vision, to a more diverse and more open institution. That starts with leadership and also with personnel being reflective of the population you serve. So for example, with Jerry Cleary being, in charge, who is the chief of staff, Jerry and I work very closely together. He's a neonatologist. I'm a pediatric surgeon. So we took care, and his heart is in the right place, but then he has the business acumen to run a hospital. That leadership is different than what I've seen over the past years. So that helps with the culture of the community. Then for the first time, Abington and Jefferson has a African-American chair of surgery, which is a really big deal. And with that, you tend to bring in more diverse, qualified candidates in surgeons. And so, this idea that, if you bring somebody Black, they're going to bring all the Black people and they're not going to be qualified, is ridiculous. But what it does do when you diversify your workforce is that people tend to seek people often who are like them. Everyone does it. Look at the hospitals, right? Look at any institution. And so, but what Dr. Curtin did as chair of surgery is, with the trainees that come through, with who leads the ICU, Dr. Karen Butler, and the chief residents that are graduating under his tutelage and his leadership, has graduated more African-American residents than any other chair. And wow. I'm telling you this as someone who's been there associated with Abington for 16 years, more than I see. When I started in 2006, I was the only Black surgeon on staff. at Abington Hospital. And so then he brings Karen Butler, who's NIH funded in her lifetime, is doing cutting edge research, who saved countless lives during the pandemic in the ICU as a critical care specialist, right? And I bet in the beginning, people thought, oh, here's this Black surgeon bringing in all these Black people. But they have added so much to the institution, right? And maybe a previous chair may have overlooked a Black woman. But Dr. Curtin knew of her background, knew of her expertise, and knew she would be an asset to all of the Abington community, right? And so that's what I see is good. And so prior to that, as I mentioned, I was the only one. And now that has changed. And so one of the things I would say to everyone is that diversity is good for everybody, right? Because that means for the patient, it's like, wow, my doctor was a Black woman. Whatever I previously thought about Black women is being changed in this moment as this woman saves my life, as this woman saves the life of my loved one. You see, it's all, we can only be a product many times of the experiences and the touches and the interactions that we've had. And so by diversifying your workforce, and I'm just using surgery because that's the department I'm a part of, but it could be, in the kitchen, it could be in the OR staff, it could be with nurses, it can be all over the hospital, but that matters for better care that you receive. What can I see how other people can get involved? Listen, we have a website. It's BDCC Cares. BDCC, actually it's BDC and then cares.com. It's very simple. You can click it, you can go on there to volunteer. We always need assistance, and especially now with so many folks being out because of Omicron and its transmissibility. Lots of folks have been short-staffed. And so there are ways to participate. It does not have to be in a clinical capacity. It could be with helping us store supplies or inputting data, because the PCR tests that we do, you have to put a lot of information for it to go into LabCorp for it to get processed. And so having folks, even with line control, even with someone coming out to say, listen, I just want to let you know you're at this point in the line and things like that. So they know they're being served and someone cares about the fact, that they're here. Just there's always something. And for the students, I would say we have had now a cohort of a group, an initiative I started called Malleable Minds. Malleable because your mind is so, fertile, and it's at the young ages that you're so impressionable that those experiences carry you through your lives. And so we had kids that spent 6 to 8 weeks with us during the summer, doing different projects, canvassing areas, handing out flyers, doing data entry and things like that. So for someone interested in public health, even interested in computer technology, but you want to be in an urban environment, you can do that. I still have my office in Jenkintown on Johnson Street. So there are ways that you can still be in Abington Township and volunteer. And so that's our administrative offices with grant writing and even just sending letters back to all the people who have donated and given of their time and their resources and money to us, taking time to write a carefully crafted letter, back to some of our donors. And so there's some answering calls, sending faxes. There's always something to do. So that's how you find out, bdccares.com.
Okay. All right. So listen, I think that kind of wraps up the questions that we've had. Listen, I want to thank you, Dr. Stanford, for making the time and taking the time to sit down with us and to discuss your vision. You are certainly an outcome of Dr. King's dream. and living in that dream and making those outcomes a reality. So I know personally I will be continually praying for you and for the center and for the consortium for continued success. Just to kind of reiterate the site where people can go to volunteer, if you want to give them that website one more time.
It's bdccares.com.
Okay, bdccares.com for both the adults in the Abington community and for the students in the Abington community as well. If you want to get involved with Dr. Stanford, you need to go to that website so you can volunteer. I believe some of that work would qualify for some of the public service requirements for the high school. So if you still need that requirement, I'm sure Dr. Stanford would love to have you volunteer with her team. So,
and as I mentioned, there are things in Abington. So I thank you for asking me that question. There are, my office, I haven't, people are like, oh, you're in Philly. Aren't you going to give up? I'm like, no, my roots were right on Johnson Street in Jenkintown. And so I will plan to be there for a while.
Awesome. Well, thank you so much. It was a pleasure talking with you.
Congratulations, Dr. Alice Stanford, for being Abington's Martin Luther King Day honoree. I can think of no one more deserving or emblematic of the spirit with which Dr. King fought for equality. Every day, you prioritize the health and safety of communities who, for too long, have been neglected and forgotten. From its grassroots beginning, you have grown the Black Doctors COVID-19 Consortium with dedicated staff and volunteers into a movement, knocking down barriers to testing and vaccines for communities in need, shining a light on inequality. Jenkintown, Abington, and the Philadelphia region are blessed and proud and inspired by your tireless work and leadership. Congratulations.
Hey everybody, this is Art, your state senator. I am glad to congratulate Dr. Alice Stanford, CEO and founder of the Black Doctors COVID-19 Consortium, for being honored by Abington Township today. Dr. Stanford, you have done amazing work getting individuals tested and vaccinated in primary care. Thank you for all that you are doing. Congratulations again.
Hello, State Representative Ben Sanchez here to send a quick but heartfelt thank you to you, Dr. Stanford, for being such an incredible role model to not only your own children, but to all children across the Commonwealth and around the world. Your ability to see the need and jump on task to fulfill it is admirable. Your dedication to the Black Doctors COVID-19 Consortium and to always helping people in need is truly remarkable. You really capture the spirit of Dr. King's dream. Dr. Stanford, you are so valued, and we are honored to have you as our neighbor, our friend, and our local hometown hero. Thank you for all that you do, and best of luck in all your future endeavors.
Good afternoon. My name is Maurice Davis, also known as Tony. I am the president of the Willow Grove branch of the NAACP, and I am here to bring you greetings on this glorious day in honor of the Reverend Dr. Martin Luther King Jr. It is with great pleasure that I want to participate here today, but I need to let everyone know something. Dr. King would have turned 93 January 15th. What's interesting about that? He only lived to the reversal of those numbers, 39, a mere smidgen of a time that most people live. See, most people live to 70, which is 70 plus years. We cannot wait for a new nationally known leader to develop and to take the reins in leadership for this country. Dr. King and others charted a pathway that the new leaders should be able to read about and consider following. Who is that leader, one might ask? That person is who you see every morning in the mirror, in the bathroom, living room, or dining room. We can no longer wait for the past NAACP presidents, such as Valerie Ward, Dr. Donald Clark, Alverno Kaysen, Alan Mitchell, Bill Dennis, and anyone else who I may have omitted from this list. Dr. King mentored John Lewis so that he could rally all of us to make good trouble. My challenge on behalf of Dr. King is for you to continue to stir the pot, if you will, toward the completion of the voting rights bill being permanent, because we can no longer look at it being reviewed every so many years. It must be permanent. The challenge that paying farmers, they've been paid off, y'all, because they are paid not to grow crops. We've got too much hunger in this country to pay people off to not grow crops. This way, we can have more of the Dr. Guy M. Bufords, Dr. Ala Stanfords, Dr. John Henry Clarks, Dr. Maya Angelou, Dr. Carter G. Woodson, and Kamala Harris, Michelle, and Barack Obama's. The babies must be fed. Housing and job inequality, that's a major thing that Dr. King pushed. We must push those. Access to quality education. We all came from kings and queens. And the proof is there that when we rise, so does everyone else. Join the NAACP. Our goal is, from Dr. Clark's quote, and I follow this, equity. That's the goal of NAACP, equity, which means equality plus fairness. We will work with the township, schools at every level, the police department, the county, as well as the Commonwealth. If not the whole nation, we need to set the tone for what happens to build the ties that bind so that we all will thrive. Thank you, Dr. King, for the example that you set, for the extreme sacrifice that you committed to all of us and to this whole nation. I can be reached via 215-659-7400. That's the number for the branch NAACP. Please, in this era of COVID, do your best to stay safe. Thank you.
What do you see when you look around? Are you looking for memories lost and found? What do you see when you close your eyes and remember the best days of our There's gotta be more than we can see. It's gonna be up to you and me.